Welcome to the History of Medical Cannabis and the Prohibition Timeline in the United States section. Medical cannabis preparations were widely used in Western medicine during the 19th century and were manufactured by drug companies still known today, such as Eli Lilly and Park Davis. At that time, tinctures and extracts were a common form of medication, as drugs such as quinine, morphine, and cocaine all dissolved readily in water and formed easily dosed crystalline solids. However, the active ingredients of cannabis are almost completely insoluble in water, making an efficient extraction virtually impossible at the time. It was recognized that preparations of cannabis distributed through pharmacies were widely variable in strength and potency, and this, in part, is why the plant fell out of common usage. Another practical issue was that at the time, cannabis was primarily cultivated in Morocco, China, and India, and could take as long as a year to reach the West. Storage conditions on transport ships were not optimal, and water, rodents, and rot could easily render the cannabis unusable well before it ever reached its destination. Three main factors contributed to the eventual prohibition of cannabis as medicine in the United States. First, cannabis was mainly used as an analgesic and sedative, so when the aspirin tablet was first developed in a much more reliable and easily dosed formulation, it quickly supplanted cannabis usage. The additional development of substances such as chloral hydrate and barbiturates, also in easily dosed tablet forms, made the unreliable medical cannabis tinctures practically obsolete. Secondly, after the Great Depression, an anti-immigrant mindset swept the nation. Cannabis, which was largely introduced to the United States as a recreational drug through Mexican immigrants, quickly became stigmatized to represent everything Americans should stand against. The term marijuana became more widely used during the 1930s as it was felt to present a more foreign sound and helped promote the racist propaganda that was coming to be associated with its use. William Randolph Hearst, a newspaper tycoon in the mid-1920s, also had an invested interest in the lumber and paper industries, both of which were threatened by the competition of hemp-based products. He began to strategically remove the words cannabis and hemp from his papers and only referred to the drug in print as marijuana. He also ran all of the most outlandish stories linking cannabis usage to violent acts and criminal behavior, leading to a widespread propaganda campaign against the drug, which spread like wildfire. Finally, a new head of the Federal Bureau of Narcotics, Harry Anslinger, was appointed. He was financially backed by the alcoholic beverage industry, which was just coming back from prohibition and did not want competition in the form of cannabis. Harry Anslinger would prove to be one of the most powerful forces in the eventual prohibition of cannabis in the United States. Harry Anslinger, the commissioner of the Treasury Department's Federal Bureau of Narcotics, played a key role in the prohibition of cannabis in the United States. It is important to understand that he did not hold his office without bias, and these quotes are a small representation of his true colors. The 1937 Marijuana Tax Act was an excise tax imposed on the sale, possession, and transfer of cannabis, meaning the tax was levied on physicians prescribing cannabis, pharmacists preparing and selling cannabis, and medical cannabis cultivation and manufacturing companies. This represents the first legal action which referred to cannabis as marijuana, and this was an intentional substitution. The American Medical Association, which referred to cannabis by its appropriate medicinal name, did not understand that the Marijuana Tax Act had anything to do with cannabis, and therefore was not given an appropriate opportunity to speak against the Tax Act before it was enacted. Harry Anslinger made inaccurate and racist claims to Congress about cannabis with absolutely no medical or scientific evidence to support his words, and still the act was passed. This act was pivotal and intentional in making cannabis essentially impossible to produce or prescribe in the United States. Around this same time, the film Reefer Madness began circulating as a propaganda film about the dangers of marijuana. Although the film is now a comedy cult classic, at the time, it painted a very scary, albeit completely false, picture of cannabis to help push public sentiment against the drug. In 1942, cannabis was removed from the U.S. pharmacopoeia, thus losing its remaining mantle of therapeutic legitimacy, according to the American Medical Association. In 1951, the Boggs Act established 2 to 5 year minimum prison sentences for first offenses involving cannabis. There was no differentiation made between users and traffickers. The same sentencing applied to all cannabis-related offenses. This was based on mistaken beliefs that all users are addicts, that drug addiction is contagious, and that drug users should be quarantined to protect the population at large. Just a few years later, in 1956, marijuana was added to the Narcotics Control Act, which led to an even stricter penalty of 2 to 10 years in prison and a fine of up to $20,000 for first-time possession offenders. The final nail in the cannabis coffin came in the 1960s and early 1970s with Nixon's war on drugs and the introduction of the Controlled Substances Act. The CSA established 5 schedules of classification for drugs based on their potential for abuse and addiction. Cannabis was placed in Schedule 1, which are drugs classified as having high potential for abuse, no currently accepted medical use, and a lack of accepted safety for use under medical supervision. Interestingly enough, the initial scheduling of cannabis as Schedule 1 was given on the recommendation of the Department of Health, Education, and Welfare, who stated, quote, "Some questions have been raised whether the use of the plant itself produces severe psychological or physical dependence as required by a Schedule 1 or even Schedule 2 criterion. Since there is still a considerable void in our knowledge of the plant, our recommendation is that marijuana be retained within Schedule 1 at least until completion of certain studies now underway to resolve the issue," unquote. The study mentioned refers to the Schaefer Commission report previously discussed in the Historical Studies section. Unfortunately, President Nixon's political agenda and his so-called war on drugs resulted in the Schaefer Commission's results being largely ignored. In a quote from John Ehrlichman, counsel and assistant to President Nixon, he stated, quote, "Nixon had 2 enemies, the anti-war left and black people. We knew we couldn't make it illegal to be either against the war or black. But by getting the public to associate the hippies with marijuana and the blacks with heroin, and then criminalizing both heavily, we could disrupt those communities. Did we know we were lying about the drugs? Of course we did," unquote. Finally, in 1974, the National Institute on Drug Abuse, known as NIDA, was established as the federal focal point for research, treatment, prevention, training, services, and data collection on the nature and extent of drug abuse. To this day, NIDA is the only source of cannabis flower that can be used in clinical cannabis studies.